Outstanding morning. This is Dr. Dorwin Lajot. Assalamualaikum. And today our topic is about how to avoid, infections or avoid infections now. Now, here's what we are going to learn. Number one is why we need to avoid infections. So the ways of avoiding infections is also to know what the methods of causing or having infections. Then second, thank you so much. I saw you boots. Oh, nawala sa boots. Okay, infections and also these causes of infections. Okay, what are the causes of infections? And then we will also learn the signs and symptoms of infections. It's very important and vital when we don't know, or even while staying at home today. Okay, we need to know the signs and symptoms. And Department of Health, gives us about several signs. And especially today, we are in pandemic. Okay, so if you stay longer, we will also learn how we will manage that infections. Okay, so that if you will stay longer. Okay, now, and I have something to give you after this live show. Once again, this is Dr. Dorwin Lajot, and thank you so much for watching. And I hope that you will learn today. Remember, we will be learning why we need to avoid infections. And then the methods, right? Methods of infections. Because it's important to know what are the methods of infection so we can avoid. That is very important. Okay, by knowing why we need to avoid infections, that will give us also confidence and courage to avoid infections. Then to know the methods of infections, by learning that, we can surely or increase the chances of avoiding infections. Then what? Knowing the causes of infections is also very important to avoid infections. Then if you stay longer in this presentation, in this FB Live, I tell you, you will also learn how to manage if you have infections. Okay, the food and the lifestyle that you need. Especially you are already taking to address or antibiotic, especially if your doctor already given you antibiotic. So remember, here's my principle. Okay, you don't know about this maybe. But for me, even if you are taking infections, right, in the morning you will eat, right? In the afternoon or lunchtime you will eat. And also in the supper time you will also eat, right? And most of us are also having snacks. And we are also drinking water. But we need to manage, that. We cannot manage you're taking antibiotic because you have a doctor, maybe you need some information. Then that's why we are giving you this suggestion, this opinion, that if you try that, this will help you, then you can also help others. Here's the reason why we need to avoid infections. Okay, you know what? According to a publications in Science Direct, Science Direct is a publications online of all the research of scientists, that is clinically proven, with strong evidence science that they will publish. That is just like a science magazines, that according to that publications, that there is a strong evidence, that creatinine increase or can increase or will increase if, number one, infections. If there is infections going on in our body. And later on, in a few minutes, we will learn also the method of causing infections And also, we will learn the causes and the signs of infections. We need to address and we need to study and learn. Okay, this is not to treat and diagnose, but to educate. Okay, people who have this problem, like they have kidney problem, just before having this live, that's why I was late, because I have online consultation, and still, okay, I'm wondering why, staying at home today, people have this kidney problem. So that is why it's so timely that we have this FB Live, because I know that I will not take this down in this in my FB page, but it will educate some people who have, okay, and who know that they have friends who are suffering from this problem that we mentioned. Okay, creatinine will increase, and before we mention also, and we have a topic about what are the reasons, okay, that triggers the increase of creatinine, is because creatinine is a normal product in our body. Okay, normal product, just like if we eat carbohydrates or meat, okay, there is a product, protein. If we eat carbohydrates or rice, there is a product, carbohydrates. In our body, according to that publications in the Science Direct, okay, that creatinine is just a product per 70 kilograms of body weight. That is 2 grams of what? Creatinine. Okay, so meaning when there is casting of muscles in our body, okay, there is what? A ratio of what? Result, which is this what? Creatinine. Okay, meaning that if there is a casting of body mass, okay, there is also what? A result of creatinine. Now, okay, but there are also, okay, like abnormalities of casting, okay, of muscles. Like for example, number 1, necrosis, meaning decaying of the body. Okay, when there is a process of decaying, meaning the necrosis, in medical term, necrosis, then there is also what? A release of, or a product of, creatinine. If there is injury, there is also a release of creatinine. If there is anemia, there is also a release of creatinine. If there is burns, there is also a release of creatinine. Meaning creatinine is just only a product, okay, of so many factors. That is why most people that are having problem with this creatinine need to understand several causes, okay? Several causes why there is creatinine. That was our topic before, okay? That creatinine is just a product of so many factors, right? What? Necrosis, meaning the decaying of the body mass. And there are also many causes of why the body mass is also decaying or degrading inside, meaning cancer, injury, infections, burns. So since that is what? Normal, the decaying, there is also an abnormal causes of decaying of the body that leads to release more what? Creatinine. So if you want to control creatinine, you need to also address this necrosis, infections. That is why today in our topic, we need to understand clearly about these infections. So, I saw you, Ate Amy, thank you so much for watching, and please, okay, tell me in the comment section if where you're coming from, okay, and please tag your friend in the comment section so that if you find that this is helpful, then please tag, okay, your friend, okay. Now, because today there are many people suffering from creatinine, but they don't know that they have these infections. Okay, so the first question that we answer already is what? Please comment. What's the answer? Why we need to what? Avoid infections is because we want to address also this creatinine, because when there is infections, there is painful what reaction, or there is pain, and we don't know if there is also dying or decaying of the cells, and that will also lead to increase of creatinine. Okay, so infections. Now, that's very important. We need to 100% or lower, maybe 90% avoid infection, because when we learn that we can avoid infections, then it is helpful for us, right? So, because kidney, okay, is the most expensive problem, okay, the most expensive problem in our country, or even outside, even in the US, they are also having that kind of problem. Yes, thank you, Ate Amy Lagundo. Thank you so much, from Coronadal City. Thank you so much for watching. Okay, now, what are the methods? Okay, we need to know the methods of infections. So the methods, according to many studies, okay, I gathered a few of them that help us avoid infections is what? Droplets. That's why in COVID, okay, we are avoiding them through wearing what? Face mask, because we are avoiding the droplets, okay? That's the way of transmission, droplets. And then also what? Touch, contact, okay, contact. That's why not only COVID that contact, there is also contact that is also for marriage, okay, or for couple, like transmission, HIV. So that's also a process or method of what? Having or getting infections. That is very important, right? Hygiene or droplets, contact, hygiene, okay, proper hygiene. That's why we need to wash our hands. But let me tell you this, okay, that infections can what? Can go through our body through what? Ascending infections. What is that? When there is hygiene, washing your hands or contact, there is also contact in the ascending infection through what? Private, okay, private part of the body, like for example, urethra, okay? Urethra, women are getting this moss, okay, in the cervical, okay, urethra, passing to that area. That's why there is cervical infections, right? Women. So that is ascending cause of or method of infections. That is why hygiene is not only hand washing, okay, but also not only washing your feet, but also washing your private part. Often, many are reducing the pH level, but some are suggesting that you need only to use distilled water or clean water. Clean water, that is very important, and women should take care of going to CR, because the method of infection is ascending infections, right? Ascending. And there is also a method of infections that is descending through oral or what? Digestion, meaning you eat like food that have or has contaminants, like sometimes people love to eat what? Yes, Yuri Dulus Reyes in Tagua. Yeah, Dulus Reyes, thank you so much for watching Tandag City. And Madam Lyle, okay, Lyle Real in, I think, in Gusak. Thank you so much for watching. Please tag your friend. Okay, so most people love to eat bahaw. Do you know what is bahaw? Bahaw. You cook rice in the morning, and then people love to eat that. If there is a leftover, we still eat that in during lunchtime. And then if there is still leftover in your lunchtime, still we eat that during supper time. That is why most expert, okay, advise, okay, chef, they advise in proper preservation, like right temperature of coldness when you put that in your refrigerator. Because if you don't put that in refrigerator at the right temperature, rice can easily be deteriorating, and molds will also come. Molds is the start of the breeding of bacteria that can cause infections. That is what is dangerous. When you eat that, okay, there is a sign of that. When there is, I think, a slight change of taste, but the smell and also the texture, okay, when the rice is becoming wet, okay, that is already the start of getting molds. and you should be careful about that. Okay, so oral contact hygiene, droplets, or airborne, or you are inside using aircon when your aircon is not good, and there is also what inside, there is prions. So that is the methods of getting infections. We need to what, be conscious of that. There is also like if we are cleaning our home, right, or our house, like the window, the curtains, okay, the curtains that been there for a year, and when we move that, okay, there is what, dust, right, and there is in every dust, there is what, there is possibility that the bacteria is there. That's why wearing a mask, if that is airborne or droplets, then wearing our mask is important, or face shield is also important when we go to an area or when we plan to clean our house, when there is no proper ventilation, especially there is no window and sometimes you don't open the window, okay? So that is one way, that's method, right? That's a method. Now what causes the infections is the bacteria that is in what? That's the third question. What causes the infections is when the bacteria is in our food. The bacteria or the virus is in the food or in like the blood or in our hands, viruses that is in our hand. Like today, according to current or recent result or report, that bacteria or the virus, especially the COVID, can, okay, I don't know if that is true, but can or will stay, okay, will stay for about 9 hours, right? That will stay for about 9 hours. Okay, so since we know that, we need to identify where these viruses or this bacteria is staying, like food, in our skin, or in clothes, or sometimes in water, okay? And sometimes when we eat, we know that the food is good and the food is right, then sometimes we eat. Because what? The method of infections, if that is oral, then if that is from food, when we eat that, it will penetrate in our what? In our body. Okay, when that virus and that bacteria is in our body, what will happen? It will, number one, infect. Okay, there is infections. And when there is infections, there is a possibility that some tissues or organs or cells will be damaged or will be injured. Remember, injury can cause your cells or muscles to what? To die. And the process of dying cells will also increase the creatinine. Can you see the flow, the format, why creatinine is the end? That is why most scientists today saying, this is very sad to say, that when the creatinine is there, okay, and it goes up or increase, it will be the sign of complications will happen. So complications will happen if the infections, okay, is there. That is why we need to identify the method, we need to establish why we need to avoid infections, and we need to also identify the method of infections. So limiting infections, although we cannot 100% avoid, because like today, COVID, we cannot see them, okay? We cannot see the COVID, we cannot see some of the viruses, and we don't know that some people are what? Having that bacteria or what? Virus. Okay? So, how to manage that? So in a few minutes, we need to learn what? How to manage that. Okay? We need by knowing the signs. Are you ready? If you are ready, please comment, okay? Or please type that in the comment section if you are ready to know the signs and symptoms. Here's the number one, okay, signs of infections that I listed from the CDC, okay? CDC, Center for Disease Control, okay? So, Center for Disease Control, very legit, not just legit because it's a government site, CDC. I've listed here, fever, that's number one. That's one sign if you're having infections. But if you have fever, there is a partner, meaning corresponding signs. That is why if you have fever, doctor will test what are other problem. You have a fever. That just like COVID today. If you have fever, they need to know your temperature. They need to know if you have this coughing, hard coughing, or other pain or other problem. So in infections, there is also a partner of if you have fever, chills and sweating, like excessive sweating or abnormal sweating that you don't know what's the problem, what's the cause. It's very cold, but why are you sweating? So chills, you're chilling, right? And then change in cough to a new cough. Okay. Then 4 is what? Sore throat or new mouth sore throat. If you have sore throat, then you have fever and you're chilling, then that is one very important sign to know. And then this nasal congestion. Okay, nasal congestion. Okay. And here's one sign that is, we don't know that this is also part of the sign and symptoms when you have infections. That is what? Stiff neck. Can you guess? Yeah, thank you so much, Ate Amy. Stiff neck. If you have stiffness or stiff neck, that is also one sign if you have infections. Whoa. I just found out that most of the time people are having, when I have this pain management before, people are complaining of stiff neck. Okay? But we cannot say, oh, you have already an infections. But you need to know the other partner and also the burning and pain with urination. When you urinate, okay, you have fever, you have chills, you have sweating, okay, abnormality sweating, and when you urinate, there is pain, okay, sensation, then that is a sign. Then it's better to go to see your doctor. Okay, go and see your doctor. Okay, maybe your doctor will advise you for urinalysis, okay, or blood count, because when people have this infection, there is what? It's just like infection. It's just a matter of war, like police in our body and the enemy, which is the bacteria and the virus. Okay, they are fighting. So there are what? Casualties. Okay, our casualties like the cells. Okay, they have also damage. So when there are damage, there are injury. And when there is injury, there is also bleeding. Okay, so there is bleeding. That is why infections and anemia sometimes go together. Okay, because infections will make your body to bleed inside that we don't know. That's why there is painful sensation. It's either in your abdomen or somewhere, okay, or here there is bleeding. But that's why, like for example, if you're coughing, when people are coughing, they get easily what? Blood coming out because of that infections. That is a sign of infections, and there is a severe sign or color coding of the blood, like from reddish to black or brown. So that's a sign. Okay, when you can see that sign, like your open wound. Okay, there is open wound. Some wound they have a hard time to get infections because the barrier there is strong. The bacteria cannot penetrate. Okay, because the first work, here's very important. The first work of bacteria or virus, they will work to damage the barrier, like the skin, because our skin have layers. Even if the first layer is open, maybe the second layer is not open, or the third layer is not open, or in our nasal cavity or throat, if that layer there, there is a layer, including the collagen, the second layer, I think, which is most of the body part in our skin have collagen, because collagen is the second vital need of the body, second to water. Again, second to water. This collagen that helps strengthen our cell membrane in our skin. Okay, so if you know that, if you want to check in the anatomy of the skin, you can see there the collagen. Okay, this is very important. And through aging, according to report in the PubMed National Library of Medicine, that the start of 20 years old, your collagen is starting to decline. Okay, going down. Then at the age of 50, the collagen is what? Is very low. When your collagen is low, then your skin starts to what? Have elasticity problem. When your skin have elasticity problem, then bacteria or virus can penetrate easily. That's why when COVID, okay, strike here in the Philippines from March until now, the age, okay, that can go out is what? From 60 up cannot go out, right? I don't know if today 65 can now what? Or 60 can go out, right? But those people who have problem in skin are high risk. They are diabetic, hypertension, heart problem. Okay, they have what? This elasticity problem and flexibility problem. So managing this infection so that we can avoid, because the end result is what? The decaying or the death of the cells or tissue is what? The creatinine that will go up. So that is why it's very important to avoid infection. And then also to what? To know the signs and symptoms, right? To know the signs and symptoms. Then to manage it, to know the signs and symptoms, if we have that, then first is to visit your doctor, right? And maybe your doctor will ask you for urinalysis, for blood count. And second, even if you are taking medicines, remember that you will eat your breakfast, you will eat your lunch, you will eat your supper. Okay, so you need to also eat food that can help what? Manage your infections, because there are foods that can help infections, like berries, according to many studies. Okay, infections and berries, like infections in elderberries, okay, have good result and strong evidence that can help in several days in getting or adding these berries, elderberries, cranberries into your diet. Okay, especially incorporating the vitamin C that will strengthen your cell membrane, like orange fruit. Okay, according to many report also that there is high ascorbic acid in that fruit, orange fruit. Okay, orange fruit, 1 or 2 or 3 a day can help also. The red grapes can help, right? So in infections, increasing your immunity, or here is it, very simple. If your immune system is the police or the military or the army or the naval or the, shall we say, airborne, okay, that is fighting in there, we need to give them the gear, the weapon, the armory, the protection, and give them proper signal, because in our body there is what we call cell signaling, so that they can communicate for backup, okay, so that the immune system can continue the fight. So adding good food into your diet, breakfast, lunch, including if you know that there is injury, so there is bleeding, then you need to add food that can also increase the hemoglobin, the red blood cells, to support your immune system. So one of the food that you need is the chlorophyll. It can help support your blood count, right? So other thing that can help support, maintain the bacteria, okay, especially if your creatinine is already increasing. In our previous topic, if you don't know about our previous topic, our previous view, you can visit our Dr. Lajot TV in my YouTube channel, okay, about the increase of creatinine. the primary role to in your kidney is what? Limited in removing creatinine. Your gastrointestinal is the primary route of what? Outlet of creatinine. Because your bacteria, the ecosystem, the good bacteria in your colon or in your digestive system will degrade, okay, that creatinine. Because according to report, they saw that in the feces or the stool, they noticed that from a person who have high creatinine, in their stool, there is what? Less creatinine, because they found out that the bacteria is also eating that. Because, like I said, creatinine is just a product of what? Your muscles or decaying of the muscles. Like part of metabolism, right? So that's why your bacteria will digest that. Okay, so it's good to maintain your colon healthy and maintain your daily habit in your CR, removing your waste. So thank you so much for staying until now, and for those who are new to this live show today, you can repeat viewing this, okay, and please share. And if you need, okay, something or a question that you need to be answered or you need an answer, then please comment, okay, in the comment section. Please put there in your question, right? Or if you want to know more, then visit our Dr. Lajot TV. I have a lecture, a short lecture about your health. And today we are focused on what? Creatinine, and what causes creatinine to increase, okay, or to rise is infections. Next, we will learn about anemia, okay? Infections can also lead you to what? Low hemoglobin or low red blood cells. So we need to learn this anemia. And your knowledge can help many people, but your knowledge, if not, okay, in use, then it will just be a waste. So thank you so much for watching, and this is Dr. Dorwin. I'm thankful to my Cecil for assisting this program, and for those who are viewing this, thank you so much for watching, and Alhamdulillah, Assalamualaikum. See you next time, inshallah.